As we've been reporting, the new Premier of New South Wales has outlined changes to the state's roadmap out of lockdown. Let's take a look at some of the detail. All students will be back in classrooms by October 25th. Kindergarten, Year 1 and Year 12 students will still return on October 18th, with all other years returning a week later. From Monday, 10 fully vaccinated people will be allowed to visit a home, while up to 30 will be able to gather outdoors. And indoor swimming pools will also reopen for rehabilitation, lessons and laps. From Monday, up to 100 fully vaccinated people will be permitted to attend weddings and funerals. That doubles the cap announced by former Premier Gladys Berejiklian. Significant changes have also been made to freedoms at 80% double vaccination. Once that milestone is reached, 20 people will be allowed to visit a home with up to 50 gathering outdoors. Up to 3,000 people will be able to attend outdoor ticketed events. That's a big jump from the previous cap of 500. And at 80%, nightclubs will reopen, but only for seated drinking. Dancing will not be allowed. Rules around mask wearing will also be eased earlier than planned. Once the state reaches 80% vaccination, they'll no longer be mandatory in offices for people who have had both injections. The New South Wales government has announced a further easing of COVID-19 restrictions after the state reached its first double dose target of 70%. But there's concern the extra freedoms may come too soon and there could be a huge spike in infections in the unvaccinated. Associate Professor Holly Seale is an immunisation expert at the University of New South Wales and joins me now. Welcome to the program.
Thank you.
What do you make of the details that we've seen from Premier Perrottet about exactly what's going to be easing in the days and weeks ahead?
Certainly, I have some reservations around, what has been released, and I think that sentiment certainly is echoed by others. Looking through some of the kind of social media commentary and comments raised by colleagues that, it does feel like we were on, we've been on such a strong trajectory and, certainly we are seeing that in terms of, severe cases declining, number of hospitalizations declining, and certainly seeing a dip in the number of deaths, which is fabulous and exactly what we were hoping for, aligned with increasing vaccine coverage rates. But we acknowledge that we're not there yet. Whilst we are inching towards that 90% uptake level, certainly, we see when we look around the state that there are pockets in regional areas and certainly still here in Sydney also where we need to still do more work in terms of supporting vaccine uptake. And so having this kind of shift now, I think feels like it does put a bit of pressure on, how do we continue to make sure that those community members who want to get vaccinated can access the vaccine, but also feel that they have opportunity to have, ask questions, to get responses, to look at, what's happening in their community and to feel reassured and confident to get vaccinated. And it feels like we're a bit under the pump now.
It looks like the first shift of these changes will be on Monday the 11th. So what do you expect to happen next week?
Certainly we knew that date was coming. And, I think, we were starting to prepare that, bring that into conversations, highlight to community organisations and community leaders about how to broach that kind of change in practice or change in what's allowed. But, it now feels like we are, also adding so many other elements that by the time we hit the kind of phase 2 openings, that there is going to be a lot more freedom already allowed before that point. And so, this is also on the back of the fact that we, as I said, we are seeing declines in severe cases, in hospitalizations and people dying from COVID right now in the state. So for people who were unsure about the vaccine or maybe were just trying to delay receiving it, all of this is now probably feeding into their perceptions of necessity to get vaccinated. signalled by a premier who, feels like we can move forward at a quicker pace, for some people, they will interpret that as we're doing really well with COVID. COVID is disappearing. It's not going to be a threat moving forward. If I don't want to get the vaccine, why should I bother now? And that's exactly what we need to be mindful of in how we package these changes and ensure to people that, with all of the movements forward, we will see increases in cases when we see more people interacting. What is that going to mean to the unvaccinated populations? And why are we suddenly signaling these changes in a quicker pace than what had been outlined by our past premier? And so we need to prime people. We need to make sure that their understanding is on board with where the government is going. And for the remainder of us who have a role in trying to be the intermediary between communities and community leaders, making sure that they also know how to communicate this back into their sectors.
Two of the major changes that stand out to me are around masks and also hospitality venues, which includes nightclubs. On the masks, office workers won't need to wear a mask once vaccinations reach that 80% mark. And also at 80%, event businesses, nightclubs get greater freedoms, including increasing capacity from 500 to 3,000, which previously wasn't meant to happen until December. These are pretty big shifts after we've been hearing so much from epidemiologists and health officials about these two components, masks and large gatherings.
Yeah, it's really hard to keep up with all of the changes, and certainly around the masks, the language could be a lot clearer. The kind of sentiment that I saw was yes, wouldn't be needed in offices, but then there was no mention about the other indoor venues and whether masks would be continued to be needed there on public transport. So we need a really clear line around what's going to happen with masks. And certainly if we look internationally, we have seen certainly many European countries and even the United States that has moved forward with reducing the recommendations or the restrictions around when you can or when you need to use a mask, and have had to do a backflip because caseloads went up and hospitalization numbers went up. And so, that certainly, happened in situations where there was lower vaccine coverage. But, I think even in places like Singapore, we have seen these reinstatements of some of these public health measures. So what's going to happen here? Let's not be too hasty. Masks are working very well. The community is on board with them. Let's start with, yes, taking them out from outdoor settings, shifting to restricting them to the indoor settings firstly, making sure they stay on while we're on public transport. Let's do this in much smaller increment steps as opposed to just withdrawing it, all the time. The nightclubs, I think there still needs to tease out somewhat what is going to happen there. And I think even the Premier acknowledged that they need to talk to public health, officials about that. But again, looking internationally, we have seen outbreaks associated with concerts and with restaurants and nightclubs, and so what can we glean from those situations, and what lessons do we need to keep applying here? So that is certainly where I think some reflection needs to be had. The suggested increases in people in entertainment venues, that increase has gone up dramatically.
Yeah, certainly some big changes on the cards, and I suspect quite a bit of conversation to come. Associate Professor Holly Seale, immunisation expert at the University of New South Wales. Thank you so much for joining me. Really appreciate your time today.
Lovely. Thank you.